So now that you have the circuit set up, I'm going to show you how to do the pre-use check, because that's important as well, because you want to make sure that the circuit is a closed system and it has no leaks. So again, the on button is on the back. So it's just to push this across and it will turn on and that part will slide out. So the machine will start to come on there now. I'm just going to try to get this away. Just takes a minute to load up. So then it will come up. Do you want to start pre-use check? Say yes. It's going to run through a whole bunch of tests. So I'll do an internal test, barometer test. Now, right now it says connect the testing tube between inspiratory and expiratory limb. So what they mean by that is down in this drawer, this is always here, this little rubber glue connector part. So you take that out of the bag. You can turn your vent like so. You disconnect your expiratory limb, and I kind of just lay it like that. You disconnect your inspiratory limb. Then you want to put this tubing between the both. So just shove it on. Just make sure it's on there like tight enough so it's not falling off. So it looked like that on the inspiratory expiratory limb. Go back to your screen and you can hit OK. So now it's going to go through a gas supply test. And again, I should have said at the beginning, you need to have your vent plugged in, and you also have to have it hooked up to the wall, so to your gas and your medical air. So it passed the gas supply test. It'll do an internal leak test. It'll do a pressure transducer test. It'll do a safety valve test. It'll also do an O2 cell and sensor test, a flow transducer test, and like this runs pretty quickly. So this is what it's going through now. So for this, you pretty much just got to stand here and wait for it to say pass, pass, pass. So it looks like everything is going good so far. And again, this is the flow transducer test, so it's just kind of giving you, you'll hear that flow going through the tubing and through the vent. And it takes about a minute. And it seems like a long time now when you're looking at it, but if you had a patient and like you're in dire need of a vent, it doesn't really take that long when you're doing it. So once it switches over to the battery switch test, there's going to be a little prompt that's going to come up on the screen. So I'll show you what you'll have to do for that as well. So it says, please unplug power cord. So I'm just going to go over and just unplug the vent. And then it will say, just please reinsert power cord. And just plug it back in. And then when it says connect patient circuit and block the Y piece, what they mean is take off this blue tubing again. Please place it back in this biohazard bag because we want to keep this. And we put it in the biohazard bag so that's way it is still clean if it went into a COVID room. Again, put it in the drawer and lock it in there again. So again, remember the white limb part went on the expiratory limb And then the blue one with the other Paul filter went on the inspiratory limb. So once you got that hooked up, I will also recommend too making sure this is on tight, because this is the line that feeds the water into the humidifier. Sometimes if this is off, you're gonna get air escaping, so you won't pass your leak test. So just make sure that's pushed on good. You can also make sure all these connections are pushed on good as well. And then you can just hit OK. And in the other video I didn't show, this little blue part comes in that package with the circuits. So like the circuit tubing. So you just make sure that part is on as well, because that's what actually blocks the Y piece. So when it's saying block the Y piece, this is the Y piece that they're talking about. So pop that on top, and this is the end of your circuit. So all you do then is hit OK, and then it'll run through the test, and you cross your fingers like that. That'll pass. Now, if it doesn't pass, then again, I would do the same thing, go through everything, make sure. A lot of the times I check to make sure, like, you know, all your connections from your humidifier is in properly. And then it'll prompt you to say unblock the Y piece. So that's a good sign. If you see the unblock the Y piece, you know that you're good. So you just take that blue part off, you hit OK. And it says, do you wish to compensate for compressible volume? And you can hit yes. And then it says pre-use check pass. So there you go. All of it passed, and you just hit OK. Then it will prompt you and say, do you want to delete patient data, trends, and event logs? And sometimes you can hit yes or no. I'll just usually hit no. And then there you go. Your vent is ready to go. It goes into like a manual pre-used like settings. So it's on 100%, a PEEP of 5, a rate of 12, and a tidal volume of 500. So again, just a quick review. To turn it up is just to turn the dial clockwise, and to turn it down, it's counterclockwise. Again, with the rate, you can turn it up clockwise and turn it down counterclockwise. Same with your PEEP. You turn it up and down, and the same with your oxygen. And that's how you do the pre-use check for the vent.